Influenza-Symptoms, what you need to know to keep your dog safe. People have written in asking about the canine influenza virus. In this video, I will review canine influenza symptoms and preventive strategies. Southern California is experiencing a surge of cases at the end of 2021. There are over 800 reported cases and 7 deaths. As many cases are not reported, this number is actually probably a lot higher. Since veterinary clinics are working at full capacity, this means there will be issues with access to care, so it's important to prevent spread as much as possible. Since there will be an increase in pets boarding during the holiday season, it will be important to prepare well in advance, as it takes at least 6 to 8 weeks to complete the series. The series must be completed at least 14 days before boarding. The Los Angeles area is also experiencing a leptospirosis outbreak, and dogs that are boarding may need protection from this as well. The term kennel cough is being replaced by the canine infectious respiratory disease complex. It includes the canine influenza virus, Bordetella, parainfluenza, canine respiratory coronavirus, canine adenovirus, the mycoplasma bacteria, and many more. The influenza virus is a wily virus that's been around since the beginning of time, jumping from species to species. The canine influenza virus is categorized as an influenza A. Currently, the canine influenza virus does not infect humans, but has been rarely reported to infect cats. There are 2 canine influenza variants that are important. H3N8 is less severe generally, and dogs are not infectious for as long as they are with the H3N2 virus. H3N8 was first reported at greyhound racetracks in the United States and is believed to be a mutation of the equine influenza virus. The H3N2 virus was first seen in China and South Korea and appears to have mutated from an avian influenza. These viruses often exist with other infectious agents in what is known as co-infections. Parainfluenza and Bordetella are the most common. Mild infections are often confused with kennel cough. Unfortunately, many dogs that are not very ill may carry the virus to more susceptible dogs that can get very ill from the virus. Symptoms include coughing. The cough can be non-productive and can progress to productive and even hemorrhagic in severe cases. Dogs may also have lethargy, fever, decreased appetite, and nasal and ocular discharge. Dogs at risk are dogs that are in social situations such as boarding facilities, daycare, grooming, dogs that ride up and down elevators in buildings with other dogs, dogs that frequent dog shows, and any situation basically where dogs congregate in close quarters. Dogs also at increased risk are the brachycephalic breeds, such as pugs, French bulldogs, and English bulldogs, dogs with collapsing trachea, or any dog with a compromised respiratory tract. Seniors and dogs with underlying kidney and liver disease, also dogs on immune suppressive drugs such as steroids and chemotherapy. Check in with your veterinarian upon the onset of a cough as soon as possible, especially if your pet frequents social settings where it could contract influenza. Pursue testing to determine the cause, and judicious use of antibiotics is recommended, as they do not work on viral infections and can do more harm than good. If a cough does not allow your pet to rest, talk to your veterinarian about options to relieve it. Ease pressure on the neck with a harness. Discuss risk factors with your veterinarian and consider vaccination. This will be required for pets boarding this holiday season. Since co-infections with parainfluenza and Bordetella are prevalent, consider the intranasal vaccination over the injectable or oral forms. The oral form only includes Bordetella and does not include parainfluenza. The injectable does contain Bordetella and parainfluenza, but I prefer the intranasal route. It's not injected, and it's just another way to confer immunity. The entire series takes 6 to 8 weeks to complete. It's important to take a proactive approach as you will need immunity on hand before it's too late. Check with your veterinarian if your dog is vaccinated, as many times the vaccine manufacturer will cover any tests related to coughing and potentially an influenza infection if they were vaccinated against it. They will also often pay for hospitalization for any pet that gets ill related to the influenza virus. Dogs routinely share water bowls at daycare and the dog park. It's time to start carrying your own water when you're out and about. Talk to your veterinarian about your pet's risk factors, such as underlying conditions that might compromise them. Are they in social situations where you should consider the vaccination? If so, it's important to remember that, again, there's a 6 to 8 week period of time that is needed prior to being challenged, say at boarding or daycare, to protect your pet. So you must be proactive instead of reactive. Make sure everything is done, again, before your dog shows and social events, and begin, at least 8 weeks prior. Treatment really surrounds supportive care, hydration, and TLC. Isolate your pet. Pursue diagnostics so that treatment can be properly guided and quarantine observed, as dogs can shed the virus for 30 days or more. The basis of health and the best immune support is fortified by a whole food diet. This is just as true for our pets as it is for us. Just like the influenza virus and coronavirus are more likely to sicken humans with low D3, it is likely the same for pets. The big difference is that dogs are almost entirely dependent on diet to supply D3. They synthesize very little in their skin like we do. There is a blood test available through VDI laboratories. Ask your veterinarian about it. The past 2 years, we've been focused on our immune systems in preventing illness from COVID. Our immune system is comprised of the innate or the immune function we were born with. The adaptive immune system is the part of the immune system that we build throughout life. The memory that our immune system has the second time we encounter an infection. 70 to 80%, a huge proportion of the body's immune system, is in the gut. This part of the immune system is greatly influenced by the gut microbiome, an ecosystem of both beneficial and pathogenic bacteria. Obviously, we prefer a better balance of beneficial bacteria, and this is fortified by a whole food diet. Remember, the basis of a healthy pet is a whole food diet that supports a healthy immune system. Please subscribe and share this video to get the word out. Here's to you and your pet's health.